Hey, it's Foot Health Month, and that's why, well, among other reasons, because he's a great resource of information, we bring back in Dr. Mark Bradley from Brantford Podiatry Associates. Welcome back, sir.
Great to see you again.
Yeah, this busy month, is this where the information gets out, or is it where people look for the information?
It's once a year we try and guilt everybody that's not watching Inside Brant into thinking about the poor old feet that they've neglected for so long.
Yeah, and it's funny because, you know, with your help, I've dealt with plantar fasciitis, and wow. I mean, that is such a weird ailment. We've talked about it before because it tends to kind of center itself in different parts of the foot. So you never know. Even though it's one area, you can feel it in different areas. If you wanted to get one message out, what would you be saying to somebody? Foot Health Month is here.
Try not to wait till things become debilitating. So often we'll get people coming in at the last possible minute. You know, I'm leaving on that cruise next month, or I've got a wedding coming up and I've got this horrible infected toenail, and it's always the last step, or get to the point where their mobility is limited dramatically.
What do we get before pain? You know, if I'm looking for that warning that I've got to do something before it gets to pain, is there a warning sign I should be looking at?
Yeah, it's no different from your car. You know, when something just doesn't feel 100% right, rather than sort of, I'll put it away in the back of my mind because I know it's going to cost me money, and wait till the check engine light comes on or something like that. You know, if you're just not functioning the way you used to be able to, or something's not feeling right, that's the time to try and do something about it.
Can fatigue, even with my feet, be one of the factors, just where I'm not able to go?
I mean,
and do I make the mistake of blaming it on, well, I'm getting older?
Well, that's what we all do. You know, it's I did a little more this week, or I just, you know, worked in the garden. And certainly, if it does coincide, you know, you've got some achiness coinciding with an increase in activity, yeah, well, that's natural enough. But if there's not really good justification, and it's reappearing, and it's been there a couple of times, you know, better to deal with it now. Not only, I mean, obviously this month we want to try and raise awareness for everyone, not just seniors is obviously a very important factor. I was just reading a statistic there at the moment. 14.6% of Ontarians are over 65, and that's going to double in the next 20 years. So we're living longer, and what's the point?
Yeah.
You know, like if we can't be active, we can't enjoy life, really and truly, why this extended life that we keep striving for?
Let's go dollars and cents, because you talked about the car analogy, so I'm going to bring it to this, the old Fram oil filter thing. Pay me now, pay me later. If I come see you when it's at, I wonder, is there a pretty good chance it's going to be less expensive than when I get to you in a lot of pain?
Well, sometimes it can be simple advice, you know, about footwear, and we've talked about this umpteen times on the show. So it's something as simple as that, specialized and individualized to your foot type or your needs or your activity. And suddenly you've got the relief, the peace of mind that there's not something going bump in the night. It's you need to be a little more careful, especially given the environment that we now live in. That can be as simple a solution as we require.
And when we get into this, and again, sticking with dollars and cents, my favorite topic, in a lot of cases, what you do, your extended health care coverage is going to cover the skill you have. Yeah,
and the other important factor is there's no one route to solve any problem.
Right.
You know, there can be an express route that may prove slightly more expensive or slightly more invasive. You know, there's always different ways to...
I guess I've never asked you the question before. Are there patients that come to you and say, hey, I'm having a problem with this, and you sit down with them and go, yeah, I can tell you're having a problem, but it's not me. You need to go see X.
Yeah, I mean, very often where it's pain, it might be referred pain from a pinched nerve or some sort of a systemic issue. And yeah, I mean, we try to expedite our role in that situation is not to waste your time. You know, we want to see you get back to full function and get that worry out of the back of your mind as quickly as possible, and that'll be maybe contacting your physician to expedite the referral. And sometimes our physicians, it does no harm to have a second opinion, sort of say, hey, listen, there is more to this. These people do need to get a little help to go somewhere else.
Happy Foot Health Month, and may you have 1,000 people enjoy it this week.
Hopefully we'll make 1,000 people happy.
All righty. Thanks for coming in today.
Thank you again.
Mark Bradley, Dr. Mark Bradley from Brantford Podiatry Associates inside Brant. We're coming back on a Wednesday. We're going to continue with the health topic. Dr. Sandy Kune is going to be here from Family Care Chiropractic. Also, we're going to be talking about heart to arts, and Sid Bolton's going to be in as we talk tech on a Wednesday. Thanks for doing it. Second day of the work week, as always, inside Brant.